My role is to talk about exercise and pulmonary rehab and what you can do. This is something that you can do for yourselves, so that's very exciting. But before we start, I'd really like you to stand up and just break that sitting habit because you've all been sitting for so long. So just a couple of minutes, mark time, just get that blood pumping. Take a nice deep breath in, big breath in and out, have a big cough. Okay, and sit down again. It's tough when we're all sitting for so long. Okay, so we've heard fabulous talks today about the diagnosis of interstitial lung disease and also all the tests that are involved in the diagnosis and ongoing treatment of ILD. So today we've talked about confirming the diagnosis, and that's with the lung function tests and the CT scans. We've also talked about a little bit about medication, but more to come about medication, and that's very, very important for you as well. But the role that I'm going to talk to you about is exercise and pulmonary rehabilitation. And I know you're probably thinking, why on earth would I need to exercise? Well, I know that a lot of you suffer from breathlessness. And it's funny that you never think very much about breathing until it's all you ever think about. And I'm sure many of you have read the book by Tim Winton called Breath, and he really talked about breathlessness because surfers were caught under the waves and they couldn't catch their breath. And when I read that, it made me think about all of you, because I thought that's just what it's like for patients who are breathless. It's all you ever think about because it starts to limit your activity. And that graph you can see underneath is really a graph from patients with emphysema, but we now know a lot of the results from pulmonary rehab that have been done in COPD or emphysema also relate very much to ILD. So what it shows you is that as disease severity progresses, so as people become more severe in their ILD, or in this case COPD, they become more breathless and they do less activity. So that's the role we're going to talk about. So breathlessness means you do less. When you do less, you become weaker. You get flare-ups of your lung disease, you end up in hospital, you become fearful and get a little bit panicky, you become weaker, and what I'm describing to you is a downward spiral. So the part that exercise plays is it helps reverse this disability spiral. So it helps reverse this downward spiral. In fact, I'm sure we all do this. This is people going into a fitness centre, and what are they doing? They're taking the escalator when they could be taking the stairs. And I know that all of you have become masters at knowing where every staircase is, where every escalator is, every lift is, so you can avoid getting breathless. So it's a very common thing to try and avoid activities that make you breathless. What happens in hospital? Hospital means that you decondition. We call decondition meaning getting weaker more, because what happens is you lose muscle strength. In fact, there's been research a couple of years ago that showed that every day in hospital you lose 1% of your quadriceps strength. And your quadriceps is this big muscle above your knee. And that's the muscle that helps you stand up and sit down, but it's also your walking muscle. The stronger your quadriceps is, the better you're able to walk and the less breathless you are. So what happens in hospital is you lose that muscle strength 1% per day. So if you're in hospital for 10 days, you've lost 10% of that muscle strength. And it doesn't come back automatically, even though you're walking around. You need to train it to get it stronger. And that's the part pulmonary rehab can help you with. Okay, so exercise is what we're talking about in pulmonary rehab, and exercise is one of the best medicines for you. So if it came in a tablet form, you'd all be prescribed the tablet for exercise. And in fact, in China at the moment, they're trying to develop a tablet for exercise to give you all the benefits of exercise without having to do it. However, we really know that nobody takes their tablets very regularly, so you're probably not going to take your exercise tablet either. So the best thing you can do for yourself is proper exercise. So let's think about exercise this morning in this session as the best medicine that you can take. So it's something that you can do for yourself. So it's very positive. So is it safe for you? Because I know breathlessness is scary, and sometimes people think perhaps it's something I shouldn't be doing for myself. Well, yes, exercise is safe for you, and also it's safe for you to exercise at home. But that's why pulmonary rehab is a really good place to start. So it's the best way to get started because you're going to learn a lot about what you can do, and you can also build your confidence. How many in this room have done pulmonary rehabilitation? I know some of you have. I can see 3 of my best fans here, and other people have as well. Fantastic. It's the best thing you can do for yourself. The gold star is a gold star for you because you've done pulmonary rehab, but also a gold star because there is strong evidence that it works in people with COPD, but there's now emerging evidence that it works in people with interstitial lung disease. So what are the benefits? The benefits are it decreases your breathlessness or your shortness of breath, it improves your strength, it improves the distance you can walk, and it improves your quality of life. It improves your confidence, and it makes you feel less depressed and less anxious about your lung disease. So no one is too severe to benefit from exercise, because even if you have very bad lung function tests, you can still benefit from exercise. We know from research there's no correlation between what you blow in a spirometry and how far you walk in your walk test. There's a generalisation that the more severe you are, the worse your walk distance is, but we know from looking at people in rehab that even if you have bad lung function, we can help you a little bit. So don't think of yourself as too severe. This is a study done in Australia by Professor Anne Holland, who spoke yesterday to clinicians, and she has done one of the only research studies in ILD with pulmonary rehab showing the benefits that you can gain. So definitely you can benefit. These are some other studies. You don't have to look carefully at it, but it shows we can improve the distance you can walk, we can improve your quality of life, but we don't change what you blow into the spirometry. So we don't change what's happening in your lung. What Dr. Troy said, the actual destruction in your lung, we don't change that, but we make you feel a lot better, and we can really improve your outcomes. So what will we do in rehab? We know we do a really good thorough history, find out all about you, and then we prescribe based on that history and a few assessments that we do. We prescribe exercise for you, exercise that is individually tailored to your needs, not anyone else's needs. And that's because some of you will need oxygen and some of you won't. Some of you will have joint pain. Some of you will have other things like back pain or osteoporosis. So we might need to tweak the exercises to suit you, and that's what we will do. As well as that, we provide ongoing support and education, which will help build your confidence and your knowledge. And that's why today is so important. And we really have to thank Suzanne for today, because she has made sure that all of you are informed about your lung disease. And that way you can own your lung disease rather than us owning it. We want you to be on top of it rather than your lung disease on top of you. And that's what happens before you know your diagnosis. Sometimes patients come to us and they have specific goals. So we will spend some time setting goals. And one patient came to me and she said she wanted help because she got chest infections. She wanted to be able to use her lungs better, and she wanted not to panic when she was outside and walking. And these are very common goals that people say, and we can help you with pulmonary rehab in this area. We've already heard about the 6-minute walk test, and I know this is what you all think, not the 6-minute walk test again. And I think Karen described very nicely to you, so I'm not going to dwell on this, that we use it in rehab because we use it to measure your exercise capacity at the beginning and at the end of rehab. So we use it there, and we can see improvements with rehab. And we expect your improvement to be about 40 metres, which doesn't sound very much to you, but it shows that a really good outcome for your lung disease. So that's really positive. What we also need to know is the lower the walk test, the more at risk you are of going to hospital. And that's why walk tests under 350 metres, we really want you to come and exercise so that you get stronger and get your walk test up over 300 or 350 metres, up into the 400 and 500 metres. And then it puts you less at risk of having to go to hospital. And now Karen's covered these. So in ILD clinic, we look at all of this, your capacity, your progress, your response to medication, and your saturation and heart rate, and whether you need portable oxygen. So I won't go any more about that. So we monitor you closely. Now we use at RPA, we use a forehead probe because many of you will have scleroderma and Raynaud's disease, and that means that when we put the finger probe on you, we're not going to get a very good reading. So we use a forehead probe. So you can see here one of our patients who gave me permission to use his photograph, who had congenital heart disease, and he had severe clubbing in his fingers, and Lauren showed you a photo of clubbing, little ballooning in your fingertips, which means we won't get any reading with your finger probe, so that's why we need a forehead probe. So the forehead probe, same as the finger probe, but we're guaranteed to get a very good reading and an accurate reading. It's not being interfered with by a thickened skin on your finger. So you can see here this picture down the bottom on your left. This was a patient who had scleroderma, and you can see the white, a little bit whiter on her fingertips, and also thicker skin. So the finger probe wouldn't work for her. We would rely definitely on the forehead probe, and that's why we use that at RPA. You all know the Borg scale of breathlessness to ask you how breathless you feel and how hard you're working. That's another important monitor when we're exercising you. We use minute by minute saturation because we know that the lowest oxygen you get is not always at the end of your walk test, and the new standards for 6-minute walk tests, which have been released from the American and European Thoracic Society, say that we need to monitor your oxygen and heart rate every minute during your 6-minute walk test to pick up the lowest, because generally the lowest will be about 2 to 3 minutes. And often when you sit and rest at the end of the 6 minutes, your oxygen may recover very quickly, so you're not getting an accurate measure. So we like to be sure we're getting the absolute accurate measure for you. Okay, so what exercises will I do at rehab? So we know that exercise training is an important part of pulmonary rehab with support and with education. So the exercises will be prescribed for you. So don't panic when you see all these exercises and think, I can't possibly do any of those. Remember, I like to think, not can't, but how. So this is about how do I live a better life? How do I get more function out of my life? Not that I can't do it. So it's about how. Exercise prescription is very much like if you were a normal athlete and you were going to a normal gym, because it's the same principles of exercise training apply to people with lung disease as apply to elite athletes. That means we build up to about 40 minutes of aerobic exercise and we do strength training. And it just might be at a lower level for you. Remember, it's individual, so it's individual for you. So we might do some cycling, and and if you use oxygen at home, we would use oxygen to exercise. There are some people who need oxygen just for exercise, they don't need it at home, and we would help work out who are those people. So we use cycling, we might use rowing, and walking is one of the most important exercises. You might go to a pulmonary rehab program in the community that doesn't have equipment. Walking is the most important exercise that you can do. And no equipment is necessary. You would use oxygen if you needed it. Arm strengthening exercises are very important because just the same as you avoid exercise out in the community, you avoid stairs and hills, you start to avoid doing things with your arms above your head. So often I say to people, do you get breathless when you blow your hair dry, when you hang the clothes out? They go, no. And I go, have you done those activities lately? They go, no. So I go, well, that's why you're not getting breathless. So let's start doing some exercise training for your arms as well, so that we know that we get your arms stronger and you'll be able to do more things. Because it's about being able to do things, isn't it? So here are some of the ways we can use we've got nice gym equipment, but we also use free weights and TheraBand to help you get stronger. We can use leg strengthening exercises. Now, the sitting to standing exercise is always a killer, but it's the best exercise you can do. I'm sure a lot of you have done that at rehab. and so we don't need any equipment to do that. So what if I have back or joint pain? Don't worry, we can adjust the exercises to you. We now have lots of lovely research showing that hydrotherapy and Tai Chi can get very nice benefits for people with lung disease. They need to be supervised probably by a physiotherapist so we can help you monitor your breathlessness. So again, always start in rehab and then you can progress onto community classes for maintenance. So hydrotherapy works, Tai Chi works, and even in Europe they're doing Nordic walking, which is using poles to walk, and that's a very nice exercise. We're not using it very much in Australia at the moment, but that's something, again, it's always better to try it in rehab so we can see what your oxygen levels are doing. Education also plays an important part. We never exercise without talking to you a lot about how you're managing. So exercise can, this patient, where the photos I've shown you, who is an ILD patient who gave me permission to use those photos, her problems were her breathlessness. Dyspnea means breathlessness or shortness of breath. Managing her flare-ups or exacerbations, and also she wanted to increase her physical activity. So that's why I've highlighted those things. But we identify your biggest problems. So when we ask you what worries you the most, they're the things we want to help you with. So if it's you've lost weight, we will make sure you see the dietitian. If it's that you're having a lot of anxiety and depression, we'll make sure you get some psychological support. So it's all part of the rehab program. In fact, if I dealt you a hand of cards, you're probably all missing a few aces. You haven't got perfect lung function. But rehab plays a part in helping you play a really good hand of cards. So you don't have to have all the aces, but you do need to be fit in order to live a good and functional life. And that's the part that rehab plays for you. So we also teach you to manage your breathlessness, and we know that oxygen can reduce breathlessness, using a frame can reduce breathlessness, and also using a handheld fan. Either here are some photos. So this is a patient using a frame because it reduced her breathlessness and we could train her better. Here are handheld fans, and often fanning over your mouth have been shown to reduce breathlessness. It doesn't cure your lung disease, but it just helps with your breathlessness. And Professor Currow will talk about managing breathlessness, and this is one of the things they've used in palliative care another way. So just fanning, so carry a fan, a little handheld fan or a little just an old-fashioned Japanese or Chinese fan. It just helps you when you're excessively breathless. It has to be over your nose and mouth, not a central fan. So they think it tricks the trigeminal nerve, one of the important nerves in your head, to feeling less breathless. So we teach you lots of tricks. We also teach you positions to manage your breathlessness, that it's okay to pace yourself and to not get excessively breathless when you're in the community. So all of these things are part of pulmonary rehab. Should I exercise at home? Well, yes, we always write you a prescription for home exercise, but sometimes it's as hard to understand as this. So you need to talk to your physio, and we need to set goals with you, because we need to know that continuing to exercise forever, like your medicine, is really, really important. But we want to set goals with you to make sure it's something you want to do. So if you absolutely hate walking on the ground, perhaps walking in water suits you better. If you absolutely hate the thought of sitting to standing, perhaps we can design something else you can do. So set some goals for exercise, but these are the international guidelines. You want to walk at least 30 minutes a day, but you can do 10 minutes 3 times a day. It doesn't have to be 30 minutes in one go. Be as active as possible, and that means standing less than you're sitting. We know that sitting is the new smoking, and that's for healthy populations as well as people with lung disease. So if you're sitting for long periods, we need to break that sedentary posture. Join the Lungs in Action or community class, which will help you with ongoing exercise. So at home, walking is best. If you have oxygen, use your oxygen. Use a frame if it helps. But going to rehab will help you work out where you fit in this picture. These are just some of the exercises we give you on your home exercises, and I'm sure you've seen some of these pictures. We can use TheraBands as well, which are great ways to strengthen, and it's a little bit of fun as well. So all of this will be taught to you at Pulmonary Rehab. What else can you do at home? I talked about physical activity. We know people with low levels of physical activity are more at risk of going to hospital. And that's been well publicised. So the more active you are, the more you stand during the day is actually better for you. So stand more, sit less. So they think that standing every 20 minutes, in fact, they're developing an app which on your phone or on your computer, which rings every 20 minutes and makes you stand up. And that's how important it is. Boring, I know. But standing every 20 minutes breaks that sedentary sedentary posture. So you need to do that because it's really important for your health. I always say things like throw away the Jason recliner, hate the Jason recliner, throw away the remote control. Because you know what you do in a Jason recliner, don't you? You put your feet up and it's very hard to get up, even to answer the phone. Stand when you're answering the phone. So if you've got a mobile phone and it rings, stand up to answer it. That's a very simple way to increase your activity. Use the stairs. Slowly, pace yourself on the stairs. Deliver a message rather than an email. Kettle exercises, I call them kettle exercises. While the kettle's boiling, you can actually mark time on the spot. You can do some little mini squats. So you can actually do a little bit of exercise while the kettle's boiling. But we can teach you these things in pulmonary rehab. So in summary, pulmonary rehab works to improve your exercise capacity, your quality of life, and your shortness of breath in people with ILD. It really does work. Early referral is important, but it's never too late. Patients who drop their oxygen during the 6-minute walk test may need oxygen to exercise, but that's okay. That means we can work you harder and you can get a better benefit with rehab. Programs should include education with some of these things I've mentioned today. I've only touched on some of it, but education can be about medication, it can be about diet, it can be about all those other things, anxiety, how you're coping, how you're pacing yourself. But don't delay, contact rehab, maybe Monday, not today, because we're probably not there. So let's take the im out of impossible so that you can enjoy your life. Thanks, everybody.